dealing with access issues. I think, Dora, you mentioned that a little bit. By providing culturally responsive service, I think that makes a difference. That means people will be more inclined to want to continue to use our community clinics. Transportation is an issue. If we are in the community, then it makes it easier for people to use our services. And I think, obviously, we need to maintain our quality. Also, collaborations. We are now participating with LAUSD in providing school-based clinics. I think that's a wonderful collaboration. It's a wonderful way to serve an entire community. And we've joined a network recently of hospitals and community clinics, which has a goal of sending those patients that come to emergency rooms out to the community clinics. Great cost saving, and it also means that we're working together to try to solve the problem. So I think there are a lot of things we can do to make sure we retain our patients.
One of the concerns too, because of the shortages we have now with nursing, some of the allied health professions, physicians, primary care, the concern too is if you now give all these people access to the system, will we be able to handle it? So I think one thing with healthcare reform too is that we have to be sure we provide adequate funding to expand these training programs so we have the staff, the personnel there to take care of these people that will now have access to the system.
The reason primary care is so important in interceding on that level is that it's where prevention can be deployed. And that's a critical thing for making sure we get our people and our communities healthy. And prevention isn't necessarily an intervention by a healthcare professional. It's actually other programs in the community that can also support a healthy environment.
More access equals not enough doctors, not enough nurses. It reminds me of the argument with LAUSD that they say, well, we don't want every student to show up because we won't have enough teachers, so we're okay with 50% dropout rate. We'll build more schools, build more teachers, train more people, use stimulus money for that. So it's just, there's a lot of similar arguments, interdisciplinary.
Reform might do something that would help on the cost side here beyond the general feeling many people have. We do more prevention, we'll save money. In the end, you do more prevention, lots of people get more services, that's all great. The research doesn't necessarily suggest that it's going to save money overall because so many more people are going to be getting so much more care. But do any of you have specific ideas to send to Washington on the cost factor? Question.
Well, the Commonwealth Fund estimates that with a modest investment, we could save the healthcare system over $493 billion over 10 years by reducing the prevalence of just tobacco use, obesity, and creating incentives for participation in wellness programs early on. Congressional Budget Office doesn't even go that far when you're looking at, they only go up to 10 years. So by investing now, we will save way much more later on in the future.
It's truly a case of having to front load. We do have to. It's the only way it works. You have to spend money to save money in the end, and that's what prevention is about. That's what primary care, whether you're FNPs or you happen to be a doctor or you're a PA, it makes no difference, or you're just a nurse who's doing health education and dietitian information. It all has to be front loaded because the fact is the patients that you had up on the screen there, here you have someone who's saying my Actos is $282. Well, if you didn't have diabetes, because you're has a situation of obesity and an unhealthy lifestyle that we haven't helped you understand what that means, then you wouldn't have that expense. And part of our problem is health care reform is supposed to be health care. That's what happens between the healthcare provider and the patient. This is health insurance reform in most cases that we're dealing with, and we need to make sure that we're clear that health care reform needs to happen. And that's the front loading of making sure that preventive services actually make a difference, and we partner with our patients to teach them how to care for themselves. That's sustainability. If we just give them health care but we don't teach them how to take care of themselves and actually become a partner in that aspect, we're going to keep paying the same thing over and over again. It won't change.
It's fortunate that Randy's not here today because he can definitely speak into this a lot more eloquently than I can. But we have met with several health organizations to try to sustain that prevention and education program as it relates to diabetes in seniors. And we had a CEO of a hospital just look at us in the eyes and say, I'm sorry we can't help you with that because there's no money in diabetes. So that was the end of that conversation, unfortunately. So it's very disconcerting to have these kinds of conversations and know that this attitude is still out there. And I get it, these companies are going to make money. But I still have to advocate for our communities. So when it comes to cost, well, it's going to save a lot more dollars to have these people not become ill, as opposed to, having a doctor say, well, we're just going to have to cut the limb and then bill. Now, when they bill, who picks up the cost? And that's the question here. So when it comes to saving money long-term, what are we going to save?
I heard from Gloria some value in the exchange type thing, especially for you as employers, in terms of a better way to get insurance for your own employees, some options there. A lot of discussion about health professionals and problems getting the right health professionals in the right places, family practice residencies, funding through CMS, we all know that comes through Medicare. Community clinics need to think about in terms of mechanisms that will help them retain patients, which may be both in their own private sector kind of role, but also in terms of what might they be looking for from Washington that's going to enable them to do that. Adequate funding for all to have access, and the nexus of primary care deploying prevention kinds of strategies. That's what I heard. Maybe we can come back and we have to see if there is one or two things in that all of you think there's a message to Washington. What I heard is it relates around workforce issues and making sure the right people are in place if we're really going to shift to a more prevention, primary care type strategy. We may be 10 years away from doing it, and I think personally that's an interesting argument for people like yourselves to make to Congress. This is investment, and maybe that's an argument that's not been made effectively enough. Okay.